So with type 1, many of you probably know that is the type of diabetes where your pancreas just says to heck with it. Your body actually attacks the beta cells in the pancreas, which is the part that makes insulin, and makes it so you just can't make insulin anymore. And insulin is that hormone that should be made to manage your sugar. It moves sugar. You know, you eat your food, your nutrients are absorbed from your gut into your bloodstream, and then you got to do something with it. And so the insulin moves specifically your sugar, your glucose, into the cells so that the cells can do something with it. It uses it for energy. And so if your sugar doesn't get inside of your cells, your body's kind of going, where's the sugar? I need more sugar. What's going on? So, and it thinks it's starving. So that's why you've got to give insulin. With people that have type 1, it is a necessity. There's no ifs, ands, or buts. Insulin has got to be administered. That's all there is to it. Whether it's injected multiple times a day, or if it is administered through a pump, either way, insulin has got to get in. We found through research that managing blood sugar and keeping blood sugar as close to normal, which would be a fasting level between 80 and 130 is a recommendation, and then 2 hours after you eat. Some guidelines recommend less than 180. Some guidelines recommend less than 140, but keeping your blood sugar as close to a normal level as possible helps to improve the safety of your eyes, so that you can continue to have good vision, protects your kidneys so that they continue to process and remove impurities from your body, and then also protects your nerves. People that have high blood sugar for a long period of time, there's all that extra sugar in the bloodstream does damage to all of those small vessels in the eyes predominantly, in the kidneys, and in your nerves, and you see people that kind of lose sensation in their feet. So it damages all those nerves. So that's why it's important to manage blood sugar and keep it as close to a normal blood sugar as possible. That's where insulin comes in. So the goal is to make blood sugar stay throughout the day, regardless if you're eating, sleeping, running around, or going, studying from home, keeping that blood sugar as close to normal. So that means sometimes your blood sugar is going to be lower, like typically when you're sleeping or you're not doing so much, and then it might go up when you eat. So over time, or over a course of a day, somebody that doesn't have diabetes or sugar might start relatively in a normal lower range, like maybe about 100, and they wake up and their blood sugar starts to climb, and then they eat breakfast, and their blood sugar will go up, but their body will naturally make enough insulin to respond to that sugar that's being absorbed in whatever it is that they're eating, and that insulin will come out from the pancreas and take the sugar and move it into the cells so it can be used for energy. So in people that don't have insulin production, so predominantly in type 1, that sugar will start going up. It'll just, there's nothing to bring it back down. And so that's where we need to administer insulin. So some people will administer fast-acting insulin or rapid-acting insulin. Some examples of rapid-acting insulin might be Novolog, Humalog, Glulisine, Fiasp is a new one. There's another new one, starts with an L. I haven't figured out how to pronounce quite yet. It's got too many consonants in it for me, Lumev or something in it. And they will administer a certain amount of insulin, of that rapid-acting insulin, right at the beginning, or maybe 15 minutes prior to when they start eating that meal, whether it's breakfast, lunch, dinner, or even a snack if it's a more hearty snack. And that is just to match how someone's blood sugar will naturally come up and come back down when they eat a meal. And so that insulin is to match it, to only last that period of time, a short period of time in the body, to match that duration of time that the blood sugar would usually be up and then come back down. So it kind of kicks on, you inject it, it starts really quick in the body to have an effect, and then it brings the blood sugar down quickly. And so some people with type 1 diabetes that inject their insulin, meaning it's not in a pump, they're not pumpers, but they're injectors. They will administer that fast acting, that rapid acting bolus of insulin right before they eat breakfast, lunch, dinner, maybe sometimes a snack. And sometimes people will give a larger amount or smaller amount. Usually it's matched to the amount of carbohydrates that the individual eats.